Hello, everyone. My name is Ishita Srivastava, and today I will be talking about the causes and effects of the gender health gap and what we as scholars, researchers, and doctors can do to improve it. To tell you a bit about myself, I'm from Irvine, California, and I'm an incoming freshman at UC Berkeley this fall, where I will be majoring in global health and molecular biology. I hope to pursue medicine in the hopes of improving medicine and healthcare accessibility around the globe. As the chapter president of an organization called She's the First, I worked hard in the past 4 years to raise scholarships for women to receive an education in countries like India, Ethiopia, and Somalia. This in turn has helped me learn more about the gender gap that exists in all aspects of our lives, especially concerning health. Even in our current world with COVID, we are clearly able to see the disproportionate effect on women. Throughout the pandemic, women lost their jobs and continue to do so at a rate of 1.8 times of men. This largely stems from the stereotype that women should be held responsible for unpaid childcare, which essentially causes them to take more time off and ultimately lose their job. With the disproportionate job loss, there has been a significant reduction in women's education as well as their financial security, which puts their livelihood in danger. Another core example of this disparity can be seen through the lack of inclusion of women in medical research. In fact, in the 20th century, most research was conducted on white males, which has caused most of the healthcare in today's day and age to be geared towards them rather than having a more inclusive and holistic approach. This impacts medicine and procedures today as it fails to account for the biological needs of women as well as other ethnicities and genders. For example, antiarrhythmic drugs have a greater risk of causing lethal cardiac rhythm in women. However, this was failed to be observed since their participation in research was so low. Furthermore, heart disease is the leading cause of death in women, but only 35% are represented in research. This brings me to another gap we must address. Much of the effects of the gender health gap are also seen in women dealing with chronic illnesses as opposed to their male counterparts. Although women are shown to live longer, they have a much more reduced quality of life. Biases in the healthcare system, as well as individual physicians and medical professionals, leads to the dismissal of their pain and often neglects their entire illness as a whole. In fact, in many clinical settings, research has shown that resources are unequally allocated due to discrimination in gender, race, and ethnicity. Now, as we look at this information, it is absolutely critical to understand the term intersectionality. This essentially describes the interconnected nature of race, gender, and other categorizations that create independent systems of discrimination. Thus, it is important to recognize that many inequalities stem from social determinants like education, wealth, and even geographic location. Since women have higher rates of unemployment, it is no surprise that they're unable to afford proper health care. They suffer more as well due to the lack of accessibility as they reside in rural areas, which often lack proper institutions. And even so, even if they choose to go outside to an urban setting and seek healthcare there, they must be able to afford transportation and child costs, which is often unbearable to women living under the poverty line in many of these rural areas around the world. Even more so, women across the world are much more targeted for abuse, which results in about 19% of total disease being from rape and domestic violence in women. And this is not to only say that this only affects women. The gender health gap also affects men in the sense that they're much less likely to receive treatment for mental health conditions merely due to unjust stereotypes. For example, society's standards dictate that men must maintain a rigid exterior to prove their masculinity and never show emotion. And this kind of toxic masculinity can actually lead to increased rates of depression and suicidal thoughts in men, as they're never able to depend on people emotionally or connect with their peers and family. This also has a toxic effect on many men's alcohol dependency, as it causes them to partake in these rather masculine traditions such as smoking, drinking, which result in toll on not only their mental health, but those around them as well. However, change always starts small. It has to start with an individual person. Thus, it is crucial that we educate ourselves. And as we enter workforces, we keep in mind the gap and make an active effort to counteract it. For example, it is essential that everyone is included and feels respected in a workplace. And these places need to be better set up to improve access to services. For example, workplaces need to be able to provide men with or provide equal opportunities for counseling, as well as respectable resources for childcare for women who are not able to take that kind of time off of work. Furthermore, clinicians must educate themselves and recognize the psychological and hormonal differences between gender, race, and ethnicity to make sure that all people are being provided with the best healthcare they can possibly have. These differences are crucial, and as I mentioned, many diseases have different effects on women and men and different ethnicities, and that is why it's absolutely essential that we screen for these kinds of differences and these types of patterns to make sure that everyone is being provided the best healthcare possible. Even us as researchers and scholars, we can be more inclusive while designing studies and ensure that they account for sex and gender. It is more crucial now than ever to screen data for patterns that may carry gender-based healthcare implications. I truly appreciate you being here and want to thank you for all the time you've taken to listen. If you have any questions at all about the resources, ways to get involved, or anything else, please feel to contact me at my email, Ishita_Srivastava@outlook.com, and I will get back to you as soon as possible. Thank you so much and have a great day.